My partner, Dr. D.Danzer, that I absolutely adore, unfortunately had to run out of the office, and hopefully will be back before this is done. We look forward to having him back. I'm Shahin Ghadir, like I told you guys. I'm one of the founding partners. I'm board certified in obstetrics and gynecology and also reproductive medicine. And again, welcome. Next slide, please. Kathy. I would love to introduce Kathy. I've been waiting for this moment for a really long time. We are very proud to have Kathy Xydis here. She is our clinical nutritionist that's in-house and is doing an amazing job. I would love to give you the opportunity to introduce yourself so everyone can hear the amazing things you're doing for our patients.
Thank you so much, Dr. Ghadir. I'm so thrilled to be joining the team at SCRC and also to support all of you on your health and fertility journeys. As mentioned, my name is Kathy Xydis. I am a clinical nutritionist. My master's is in nutrition and integrative health. I'm also board certified as a nutrition specialist and currently enrolled in my doctoral program to become a doctor of clinical nutrition with an emphasis in women's health and human performance. So that's a little bit about me. Dr. Ghadir, would you like me to go ahead and jump into what I'll be talking about in regards to nutrition and fertility?
Absolutely. And I did want to just remind everyone that there are some slides, again, at the end of the presentation that involve more discussions about nutrition. I'm not so stuck in having to do the slides in exactly the order, but we can kind of play it by ear, but absolutely, because I'm excited to hear what you have to say as well.
Perfect. Okay. So just to start off, we've done an introduction already. So what is nutrition? You know, some may think that it's about eating a healthy and balanced diet. Maybe others think calories in, calories out when it comes to weight loss, or, you know, eating food just to provide the energy to literally survive. I'm sure we've all been in that space where, you know, you just need to get something in your system just to keep on moving. Thankfully, most understand that just looking at, you know, calories in, calories out is no longer health supportive, but instead it's actually the quality of the nutrients. So, you know, when you look at 140 calories in a Snickers bite-sized bar, it's not the same as 140 calories for maybe, let's say, a half cup of lentils. And more importantly, it's about the appropriate nutrients for each individual, how the body uses these nutrients, and the relationship between diet, health, lifestyle, and disease, and hopefully the prevention of such. So, you know, some foods might be considered as healthy foods, but they might not be health supportive for everyone. So you might have heard the saying where they say one man's food is another man's poison. For example, lentils, as we discussed before, they're a great source of folic acid, along with many other nutrients. But someone who has a bacterial overgrowth, let's say, it's actually recommended to not eat them until the microbiome is balanced again. So, you know, I get asked many times, what is the best fertility diet? I'm sorry to say there's not just one special magic diet, and I'll go into why I say that, but there are nutrients that are most important when it comes to fertility. These include folate, B12, vitamin D, iron, CoQ10, omega-3s, which are your essential fatty acids. And we'll talk a little bit more about this later on in the webinar. But, you know, sometimes it's not enough just to supplement with these nutrients through diet or even through supplementation. So we must also determine if these nutrients are actually being used in the body. So we want to assess if foods are being digested first and foremost, and then if the nutrients are actually being absorbed and utilized. And if they are not, we want to uncover why. So this could be due to faulty digestion, dysbiosis in the microbiome, a congested gallbladder or liver, and even someone's genetics. So there are also lifestyle behaviors that we want to steer clear of, but we'll discuss that a little bit later in the webinar as well. As a clinical nutritionist, I take the whole person into account. So I look at things from a systems-based whole body approach. So what does that mean? I actually look at the underlying conditions that could actually be causing symptoms and deficiencies, causing some of these challenges that we face, and also hindering your best health. So, take for instance, we discussed earlier, you know, some of the nutrients that we discussed. If someone has a sluggish gallbladder or has had it removed, they may not be able to break down their fats, which also means they will not absorb their essential fatty acids or their fat soluble vitamins, such as vitamin E, A, K, vitamin D, and their omega 3s. And as we know, these are extremely important for fertility. Another way is that if someone has a specific gene variation, they might have a lower capacity of breaking down and utilizing folate and B12. So in this case, we may have to supplement at higher doses, but also supplement with methylated or activated forms of each. So in this case, the form of folate and B12 is important for each individual patient, along with the food intake. And then another way is maybe if someone has a bacterial overgrowth. You may have heard of SIBO, which is small intestinal bacterial overgrowth. The bacteria actually may interfere with normal digestion of nutrients, so, such as iron, B12, and your fat soluble vitamins, again, which also leads to your essential fatty acids. So you can see how there's different ways that not just supplementing or supporting the diet with these nutrients is enough. We also have to look at how these nutrients are being utilized from the food that we're taking in. So, how do we figure this all out? This goes into a little bit of my process. I typically have patients fill out a lengthy intake form. Gives us a lot of information, a lot of key points for us to discuss during our in-depth initial consult. And this consult is usually about an hour and a half, sometimes even longer, where we discuss your health history, your own and your family's, past medications that can deplete nutrients, major life events that might have caused stress or other issues in the system, lifestyle, nutrient intakes, which we do take a look at, food journals, manifestation of symptoms, which can tell me a lot about what's going on in the body and maybe possible deficiencies that may be occurring. And then also to figure out how best to support moving forward in regards to your goals. So from this information, I'm able to put together my analysis and come up with a plan to work with you. Beyond this, we can also, decide which comprehensive labs we want to move forward with, where appropriate. So for example, many times we do a serum B12. And that can show someone's level, and it may be normal, like in the range, but that doesn't actually necessarily mean that they are utilizing that B12. So, when I say normal, since sometimes it may be in the range, but if it's on the lower end, this can already start manifesting symptoms of deficiencies. So in these comprehensive tests for B12, let's say, we actually test for methylmalonic acid. And methylmalonic acid is a compound that reacts with vitamin B12 to produce coenzyme A. And the main reason why you need to know that is just that's supportive of normal cellular function. So as opposed to looking at B12 in the serum, we want to actually look to see if your methylmalonic acid levels are elevated. And if they are elevated, that can signify a B12 deficiency. So this is how we go into these very detailed, comprehensive labs. This one specifically is called Nutrival, and it also tests for other markers, vitamins, minerals, toxin exposure, omega-3 levels, need for antioxidants, pancreatic enzymes, probiotics. So all of these things tie in together into what we've already seen in the initial intake, and it supports what we've already discussed. Other tests that I may run also include a comprehensive stool test, hormones and cycling, and also genetics that are specific to nutrition. We don't always have to run labs to get to the bottom of symptoms and, to create a plan moving forward. For example, allergy tests, food allergy tests. If there's trouble digesting food and the gut lining is damaged, which I can typically assess from other symptoms that we discuss, larger particles that are not able to be fully digested can enter into the body, which then the immune system reacts to. So this causes food allergies and sensitivities. So in these cases, the first course of action is to assist the digestive system and heal the gut lining. And then we're also able to do an elimination protocol to find out what foods are allergenic to each individual, because it is different for everybody. It's very personalized. So after I have a chance to meet with the patient one-on-one, then I'm able to share my analysis, give recommendations, and discuss a plan moving forward and how we can work together to make the changes needed. So, and I'm there to help support, your specific health and fertility journey. As you can see, it's very personalized. So we will discover the appropriate fertility diet specific to your needs. And so that's why I say there's not one specific diet that's going to necessarily help everybody. It is very individualized, and we have to uncover those areas that need the most support. So right now I am meeting with patients at SARC, but for the most part, I'm doing video sessions as well, obviously due to the situation that we're all in. I did share my contact information on the screen, so please feel free to email me, call me. And if you do have other women in your life that are looking to improve their health in general, we do support women's health in general. So please have them reach out to us as well. I'm happy to talk with them as well. And obviously we know that the new year is right around the corner. I believe we will be announcing a new year nutrition special soon. So keep an eye out for that. I am extremely excited to be part of the team and to be here with you. I'm excited to meet with you and get to know you and to work with you in the future. Please reach out with any questions, and I'm sure we'll talk a little bit more later in the webinar. So, Dr. Ghadir, I would love to hand it over to you and continue.
That was wonderful. I tried to make my appointment while I was just sitting there, but they weren't answering the phone. And now I'm beyond confused if I'm going to have a bowl of lentils or have my Snickers bar. But
we will discuss.
That was excellent. And honestly, it's stuff that comes really close to me and what's important for me, because I think during this process of trying to conceive, it's much more than just trying to get a healthy embryo into someone. It's trying to get a healthy embryo into a healthy body and into a healthy woman who is physically feeling good, mentally feeling good. And that's why I love our clinic so much. We try to address a lot of things, not just the patient and just getting pregnant, but we try to assess mental health as well. We try to assess different things. Kathy joined us at the same time, along with our now in-house acupuncturist, who is excellent as well, getting unbelievable feedback. We have the opportunity of not only getting your body into the healthiest way it can, but we can also physically and mentally try to help with relaxation and techniques of acupuncture that have been proven to help pregnancy as well. So with that being said, unfortunately, the definitions of infertility popped up here in front of me. And it's just a reminder for us that if you're under the age of 35, the American Society of Reproductive Medicine tells us that you need to be trying for 1 year to be defined as infertile. And if you're over 35, it's about 6 months. One of the things I disagree with is 100% this definition. And I don't think that you have to wait this long to reach out and talk to a specialist and learn about your body, because sometimes there's some things that are going on after a month or two that waiting a year would have wasted time and not been productive in any way. If your periods are abnormal, if there's hormonal abnormalities, these things do not need to be waited on and can be treated earlier on. So the most important thing about this graph is it's showing us that fertility declines over time. So the longer you wait, the chance of getting pregnant on your own is also lowest. And the preservation of fertility, which is called egg freezing or sperm freezing or embryo freezing, is one of the most important aspects of the world of fertility right now, because much of what we do in terms of treatment of fertility can be avoided in the future if a woman at a younger age is able to freeze her eggs. We love to recommend the younger the better, but we do see that many women in their 20s, the last thing on their mind is actually freezing their eggs. And for that reason, I've compromised with myself, and 30 is the age for me. So all OBGYNs or patients that ask me when to do it, I say the younger you do it, the better. But if you've hit 30, you need to do an assessment of your fertility, see what's going on. And if you know you're not about to have kids, then it's a perfect time to undergo the egg freezing process. If you are already in a relationship and you know who you're going to have a child with in the future, then I recommend putting the egg and the sperm together and making embryos. And for male partners, since studies have come out showing that the abnormalities in sperm goes up for multiple reasons, whether you're traveling to a dangerous part of the world with illnesses. Now there's been some data that COVID can affect actually even sperm quality. I think freezing sperm is important, especially if you're approaching 40 years of age. Next, please. Third-party reproduction is another topic that we really wanted to touch base on very quickly in this discussion, because it is something that's very important here at SCRC. We have an entire division of our practice that helps patients that are in male same-sex relationships, female same-sex relationships, single men and single women, all be able to conceive, whether it's the use of an egg donor and a surrogate, whether it's the use of a sperm donor, an embryo donation, or the use of a gestational surrogate or carrier. These are all things that we can help with here at SCRC. And we're very proud of this division for helping everyone who desires and wants to have a beautiful family. Next slide, please. So let's talk a little bit more about nutrition. And these are great things, and I don't have to, Kathy, stay with these slides. If you would like to, you're absolutely welcome to, but I'm going to leave this up to you to decide how you want to do this.
Go for it, and then I can jump in later and add some tidbits if you want.
Okay, wonderful. So some of the most important things for us is that higher vegetables and protein content in the diet, higher fiber and carbohydrates that are well metabolized and taken in by the body are really important for us. Women with the highest fertility diet score demonstrated that 66% of them had low risk for ovulatory infertility. So the better your diet, the better the chance that you're going to have of ovulation and of a healthy outcome in trying to get pregnant. I'm of strong belief that low sugars, trans fats, and alcohol during the time that you're trying to conceive is very, very, very important. And also, I'm not really one way or another too much on dairy. I think in moderation, everything is okay. But I am a believer that the zero fat content, dairies and things are just probably not good for us no matter where we are in our life. Did you want to add anything to that, Kathy?
Yeah, I'm glad that you actually mentioned the full fat, not low fat. You know, it definitely has caused, that definitely was a trend back in, you know, in the day, we'll say. Having fat in our diet is extremely important. And so I'm glad that you mentioned that. And everything else that you mentioned as well, the low sugar, the trans fats, alcohol, especially during this process, is extremely important as well. And when it comes to, you know, carbohydrates, I know that's another thing that we're very concerned with. You know, it's a lot of the low carbs, and that it is part of what we do look at in this. I mean, we definitely want to support with whole grains, but, you know, staying on the lower end of some of those high glycemic, let's say, carbs that we're looking at. So I'm glad that you did mention the importance of having the fat in the diet. And also, as I mentioned earlier, making sure that we're digesting, that we're breaking down those fats so that we can utilize them, and also to help absorb our fat soluble vitamins as well.
You know, one of the things, Kathy, that patients always ask me, like, you know, what diet should I be eating? I'm a huge fan of the Mediterranean diet that involves healthy, clean eating with not a lot of processed foods and a lot of foods that you just buy off the shelf and cook and eat, and keeping it healthy. I mean, I'm a huge fan of the fish, things that are light, olive oil, great fats like avocados, nuts, things like that. I think these are all super important things that patients, is there a specific diet that you believe is better? Is Mediterranean diet one of the ones that you believe in?
Yeah, so that's one of the diets that's greatly researched and has a lot of great success with that in many different areas and in different situations. And so when we look at the Mediterranean diet, like you said, there's healthy fats, there are whole grains, there's a lot of vegetables, the fish, so when we're looking at the diet, when we start adding in when you say actual food, it's food. You're not actually going to the store and looking at the ingredients and seeing what ingredients are there.
No ingredients.
If you're eating, it's like, it's just food. That's what it is. And so that's why that sort of way of eating, I'll say, sometimes I don't like using the word diet, but that way of eating, that absolutely is a great way to support fertility and overall health in general. I also like what's called a mitochondrial diet, which is similar to a Mediterranean diet. And I use that a lot with my patients. And it's the same sort of, belief. It has a lot of the healthy fats, low glycemic, whole grains. So I actually really do support that as well.
Love that. Love that. Next slide, please. Okay, great. So micronutrients are also an area that has been studied a lot. I am not an expert on them, but I do know that for the world of fertility, CoQ10, which is the strongest antioxidant available in the world, in the purest form, which is called ubiquinol, is a great antioxidant and slows down the aging of all of the eggs of the body by reducing the amount of oxidative damage to all the cells from head to toe, but definitely the eggs as well. So all of the cells that are involved in the eggs of the female slow down the aging. So if anyone's going to take one supplement only to protect their future and their fertility, it should be CoQ10 in the purest form called ubiquinol, and the recommended doses that studies out there have shown to be beneficial is 600 milligrams of ubiquinol a day. Do you have anything you want to add about CoQ10, Kathy?
No, that's actually, I was thinking of the dosage as well. That's where a lot of the studies lie, is the 600 milligrams on a daily basis, and taken in separated doses. So taking one in the morning, one afternoon, one in the evening, so that your body is able to utilize all of it. And so even, like you mentioned, it's one of the antioxidants that we need. And when I work with patients, we also do look at the oxidative stress in someone's, each personally, what their oxidative stress is, and also support them with other antioxidants like glutathione as well. But that's one of the main things that I always recommend as well, is the ubiquinol. The ubiquinol is the activated form of that.
That's great. So you know what? I'm so glad I said that, because I did not know that if you take those in a different way, for example, it makes a difference, like spreading it out during the day, and it helps with absorption. But that makes complete sense.
Yeah, and also doing it with something that maybe contains a little bit of fat. When you look at your like your DHEA, your CoQ10, your vitamin D, if you do eat something that has a little bit of fat along with that, as we were discussing earlier, it helps absorb the fat soluble vitamins a little bit better.
Great, a little healthy fat. Perfect.
Healthy fat.
Vitamin D levels are also really, really important. We check that for everyone. And healthy vitamin D is over the 30 mark, and we like to check and give you the appropriate dose that you should be taking. Also, folate and vitamin B12 are important. I'm going to let you talk about folate and vitamin B12, Kathy.
No problem. Thank you. So with folate and B12, you probably have heard folic acid and folate, and maybe even methylfolate. So folic acid obviously is extremely important with fertility, and same with B12. Now, if we are working with someone that has a specific gene variation, which is MTHFR, and there's a couple different variations, with one of them, it actually decreases the breakdown and utilization of it. And so what happens is that if you start taking, let's say something that's fortified with folic acid or with a supplement that has the folic acid, sometimes what happens is it builds up in the system. It's not able to be broken down. And that actually can cause, in certain people with this gene variation, can cause certain cardiovascular risks. And so what we want to do is personalize this for each individual in regards to the form that they're taking. So methylfolate, if appropriate. And then also B12, you've probably seen there's cyanocobalamin and there's methylcobalamin. And again, with methylated versions, they're just the activated forms of those, so we can actually absorb them a little bit better. With B12, as I discussed earlier, you can start seeing the effects of deficiencies pretty soon before you, like once you start getting to the lower end of B12, symptoms can start coming up. And you always want to make sure, when we think of even neurological symptoms, we want to make sure that we catch that in time. And then obviously with fertility, that's extremely important as well. So, and when we think of B12, the main way that we get that in our food is through animal products. And if, animal products, as far as any kinds of meats or eggs, those are sometimes the hardest products to break down. So if someone's digestion isn't working appropriately, they probably have a harder time breaking those down and absorbing the B12. So obviously that's extremely important to support digestion and absorption of that as well.
That's great. And it's also letting us know here that not being anemic and taking appropriate levels of iron supplements reduce the risk of ovulatory infertility, so not ovulating. And that's, I guess, really important as well. Is there a specific iron supplement that you like to let people know?
I do like to, I like to test for that first to see, what is. Now, when you think of even food, we have heme and non-heme, which means if you're getting, if it comes from animal products or from vegetables. So there's a couple different forms. You will absorb the iron from animal products more. You'll get more from, vegetable sources. But that's something that I obviously like to look at, lab work first to see.
That's wonderful. Okay, wonderful. So let's go to the next slide, please. Okay, everyone's favorites, but they're all to be avoided. Just kidding. So let's go ahead and, this is definitely information that's been out there for years and years. Excess alcohol, cannabis, and also tobacco have been proven to reduce the quality of egg and sperm. In many cases, especially for females, it actually affects in a negative way that's not really reversible, since women are not making more eggs. Men are very lucky. They reproduce, and about 72 to 90 days later, they have a new set of sperm waiting to be ejaculated. But I think that this is really important to know, that taking more than 4 drinks per week during IVF or during fertility treatment is actually dangerous. And that's why I tell people a maximum of 1 to 2, once or twice a week, and nothing during the time that we're trying to grow eggs during the injection process. Definitely no cannabis, definitely no tobacco. Anything you'd like to add on that, or is that okay?
No, that's perfect.
Great. Next slide, please. Let's start going through some of these questions and see if we can answer them for you. What are the most important questions to ask when choosing a clinic for egg freezing if we can't come to yours? So first of all, I want to let a lot of people know, we have people flying in from around the country, especially right now. If you wear your mask and shield yourself up and travel, it is like the cheapest time to ever travel ever. But if for any reason you cannot come, because we have had people come from Chicago, Texas, Florida, New York, and also all of the areas around us like Nevada and Arizona. But we are more than happy to help people that cannot come. I think the most important questions to ask is what kind of egg freezing they're doing. Is it the fast vitrification? Making sure that it is. You should also be asking the questions of what is their IVF success rate? You can also look at the SART, S-A-R-T website that has some of that information. Unfortunately, it's a few years behind and not up to date. You should also be asking, what has been your success rate with egg freezing? Now, I don't have that exact number, but I can tell patients, for example, from my own patients, there have been very, very few patients that froze eggs with us at a reasonable age that were unable to get a pregnancy as a result of it, especially with the newer technologies that are around. And those are similar things to ask. And you have to have some kind of connection with your doctor. If there's no connection whatsoever to the doctor or the team, we've done for people that have come to us from far away is that we help them get started in other cities, finding them a fertility clinic that helps do the monitoring, and then they fly in for a few days here to do their egg retrieval, and then they move on. And it's worked out really well for many people for many, many years. So I hope that helps. What about caffeine? Kathy, do you want to answer that one?
So caffeine, that's one of the things that I actually have most of my patients eliminate, especially at the beginning when we're doing an elimination protocol. Everyone is different. When you think of even genetically, some people process caffeine differently. So some people are fast metabolizers, slow metabolizers. So that's one of those things that, it's also the amount that you're taking in that can make a big difference. Some people do it, have some green tea. They might have a little bit in the morning, but if you're drinking caffeine throughout the whole entire day, obviously we want to support you in other ways to make sure you're hydrated. Obviously that's the biggest part. And making some of these changes will actually change what you crave, believe it or not. I mean, I have had so many people, even with sugar, that's one of the hardest things. And with sugar, they will go through this process with me and they don't even crave it anymore. They actually will try to have their favorite dessert and they're like, oh my gosh, that was awful. So, caffeine is one of those things that it's better to, if you're going to have any, keep it on the lower side. And so I don't know if you want to add anything to that.
Yeah, I do want to add to that. It's incredible that you said that because I did this genetic test that's out of Australia. I think it's called mydna.com, and it assesses what your body's caffeine intake should be. And it said for me that caffeine is not really the right thing for me. And I was always wondering why in medical school, all my friends would have a cup of coffee at 11 o'clock at night and continue to study. And I had to go to bed no matter what, because I just did not function anymore. I was able to wake up at 2 in the morning and study the rest of the morning, but it's just one of those things that you have to know if caffeine is right for you or not. But I do tell people, because I noticed that for some people it's really important, that in my world, I tell patients that one caffeinated beverage a day is absolutely fine during the time that they're doing fertility treatments and even during pregnancy. Now, that does not mean a Starbucks venti this big that has enough caffeine for a village. It means a simple cup of coffee that you make at home, like this size, and you have, and that's about it. So just, you got to use some common sense there, but I think one caffeinated beverage a day is fine, unless you're doing something that your nutritionist is helping you with about an elimination diet, then I would definitely follow their instructions. Our next question is, how long prior to IVF should you start the supplements mentioned, the ubiquinol, etc.? Now, I've got to be very clear about this. None of these supplements is going to change your IVF outcome, okay? These are supplements that are well balanced for a woman in their reproductive years concerned about their fertility. I would never delay one day for a vitamin, okay? And this is important. Now, once you've made your embryos, and you have embryos, and we haven't wasted time to get there, which is the way I like to do it, if you have to take some time to get your body in the best shape that it can be, reduce things and increase the supplements and be doing well before an embryo transfer, that I'm happy to encourage. But I do not encourage people delaying the purposes of IVF or egg freezing to get vitamins in their body, because I don't think ultimately it has any benefit that way. Would you suggest taking B12 injections that are offered at med spas? Kathy, I want to hear your point of view.
Okay, so with this, The first question is, why are you getting the B12 injections? I mean, do you even know that you have a deficiency? Do you know which form you should be, getting? So not all spas actually have the appropriate form for you. So, I think it really depends on the individual. I wouldn't necessarily tell everybody and just say, yep, it's great, go do it, no problem. So I really think you need to work with a practitioner that can assess that for you and to really help you decide whether that's the best thing to do. And obviously the form that they're offering, whether it's cyanocobalamin or methylcobalamin, and what's appropriate for you. So I really do feel like there needs to be a little bit more diving into that a little bit more to decide on a personal basis what if you should or shouldn't be.
I'd be very weary about things that are suggested at a medical spa that knows nothing about your background, knows nothing about the composition and levels of where you are with medications. I think maybe taking a B complex pill here, a vitamin here and there, is nothing that can harm you. But once it gets to the level of injections, I would be very careful.
Yeah.
And my partner has arrived. Hello, Dr. Danzer. Dr. Danzer, we've gone. Can you hear us?
Yes.
Okay, wonderful. We're answering some questions. I'm glad you were able to come back. So the next question, I'm going to actually go ahead and see who's best for. Maybe you can answer it.
Okay.
Do you have to be gluten-free before starting IVF? And as much as Dr. Danzer may know that, I know he loves gluten and desserts. So maybe I'm going to push that one to Kathy, and then the next one will go to my partner.
Absolutely.
Thank you. So with gluten, it's not, there's a lot of research that does say that it's good to be off of gluten for a certain amount of time and it can support fertility. I think the bigger question is, how does it affect you personally? So when I go through the intake and we're meeting together and we're talking a lot about your symptoms, I can start seeing clues here and there that might be something that's affecting you. Now, when I talked about the elimination protocol, that is also something that we do. We take that gluten out for a few weeks, we reintroduce, and we see exactly how that affects you. So one person may have, they may have symptoms that pop up immediately, others may not. So it really depends. Again, I know I keep saying this, it's very personalized and individualized, and we're able to start seeing that by going through your intake, looking at symptoms, and possibly if we do see some of those coming up, do an elimination protocol and reintroduce and see what pops up. So there are also tests that we can do if you have a true gluten intolerance, whether that's celiac or not. Some people, it doesn't show up on their testing, but they're sensitive. So it really is individualized. Have I seen some studies and some research saying that it can help? Yes, but again, I think it's very personalized to you and how it affects you.
Kathy, that leads me to the next question, is asking what your thoughts are on a ketogenic diet as well, and fertility and how they relate.
So with a ketogenic diet, I do not support it in the fertility, arena. There are many other nutrients that you absolutely need to be taking in. And look, there's lots of different forms of a ketogenic diet. There's ones that are extremely restrictive when it comes to vegetables and other nutrients. And there's other ketogenic diets that actually are a little bit more lenient than that. So I just don't think it's the best diet to follow during this time. Also, when it comes to a ketogenic diet, when genetically, even if someone is eating a high fat, and I'm not necessarily just talking about our healthy fats, we discussed that, we need them, but sometimes we get into that realm of eating some of these other fats. And for people that have specific genetic variations, it actually could be causing more harm. And so, again, this goes back to it being a very personalized route, if a ketogenic diet is best for you. But when it comes into the fertility arena, I don't necessarily support that being the best option.
Got it. Dr. Danzer, do you want to answer the question on what is the role of DHEA supplements, and if it's useful, and if so, what is the dose that you recommend?
So DHEA is a mild male hormone, androgen. There's been a variety of studies over the past number of years about whether androgens play a part in recruiting follicles for an IVF cycle or a natural cycle. It certainly has been used in a number of studies to enhance the egg reserve so that women that have a diminished reserve may have a greater number of follicles and therefore eggs to retrieve in terms of IVF. I'd like to say those studies are great. I think they're a little bit mixed in terms of how beneficial it is. I think it's easy to take, it's oral, although there are some women, because it's a mild male hormone, have some problems with acne, sometimes some hair growth. So those women that have the side effects, I don't encourage them necessarily to try if they persist with that. But for those that have no side effects, it's 25 milligrams 3 times a day. And again, I think the key word is it may help to recruit a better group of eggs for an IVF or even a stimulation cycle with injectable gonadotropin. But I think it's safe. I don't think there's certainly any long-term problems with it. The more immediate side effects are tolerable for most women. And again, it may help. So it's used along with CoQ10. Those are the 2 products that are usually used together and may be helpful.
Dr. Danzer, I've talked a lot. I'm going to continue to ask you some questions. What leads to male factor infertility, and can you treat it at your clinic?
Yeah, male factor infertility, which is a low sperm count or a normal sperm count with low swimming or low motility, or sometimes increased number of abnormal forms. The shape of the sperm is not normal. When you go through the testing, there may be hormonal reasons for this. There may be some genetic issues which are relatively uncommon. But it's not like the female where we have a good group of tests that we could say, this is the reason why the sperm count is low. Now, typically a man that has a low count goes to a urologist or a urology specialist called an andrologist who does a hormone panel, looks at the stimulating hormones, measures testosterone and thyroid. But most of the time, those hormone levels tend to be normal for men that have lower counts and motility. So we don't have a reason why many men have low counts and motility. Some have what they call a varicocele, which is a dilated vein that leads to the testicle, which brings extra heat and may cause decreased motility or abnormal forms. It's called a varicocele, and there is a treatment for that called a varicocele repair, where they essentially block that vein that's carrying this extra heat to the testicle. We know that raising the temperature of the testicle 1 degree essentially stops all sperm production, and that's why the testicle is in the scrotum, because if it was in the body, it would not produce sperm.
Wow. Okay, wonderful. The next question is asking us if we have worked with a lot of consumer sperm freezing services like Dadi, and I just want to quickly answer this. We do not. All of our sperm freezing occurs here in our andrology division or in our IVF lab, which is FDA approved. And we do it in a way that anyone who wants to use sperm in the future has it put away in a safe place in all of the ways recommended by the FDA. So there's absolutely no problems at all. Next question, Dr. Danzer. It says, if I had a myomectomy, 27 fibroids removed from the exterior wall of the uterus in 2020, August 2020, and planning to start trying with my hubby in January, would it be safe? And what are your thoughts on taking pre-mama products, which I'm not sure if, I don't know what that is, but let's talk about the myomectomy and also conceiving.
So fibroids on the outside of the uterus are treated surgically, or if they're small, they're just left in place. It's only fibroids that depress or involve the uterine cavity that create problems with getting pregnant or miscarrying. Hopefully all the fibroids were removed from the uterus that did not impinge on the uterine cavity. Now there's a test to look at that. It's called a sonic histogram. It's an ultrasound where they put saline inside to get some contrast to make sure the shape of the uterine cavity is normal. I don't know if the doctor told you that there was fibroids inside the cavity or impinging on the cavity, but usually after a large myomectomy, you want to get either an MRI or this easier sonic histogram done with your gynecologist to make sure the uterine cavity is in a good shape and ready for pregnancy.
Great. The next question I'm going to answer, we're going to both answer, Dr. Danzer and I, the oldest age to freeze eggs. And I want to actually alter the question a little bit. You can freeze eggs as long as someone's producing a follicle and the medications are letting a follicle grow. I think the better question to ask is, what is the oldest age that we've frozen eggs and have had a successful outcome out of it, which is probably the best way. And I know that I have had a handful of patients that were 43 and 44. They didn't get tons of babies out of it, but they got a beautiful baby out of it. And we're very, very happy that they did freeze their eggs. Dr. Danzer, have you had similar experience or older or not as old?
Yeah, well, the question is when they froze the egg. I mean, if they were 32 when they froze their egg, they can be 50 and get pregnant.
Right.
But as the egg reserve diminishes, we know at age 35, if you get 15 to 20 eggs, there's about an 80% chance of pregnancy in the future. Now, if you're 40 or 41 and you get 10 eggs, the probability of being successful with that is probably single digit. But again, it's not zero. There are women that say, well, I'm going to come in and I only get 2 or 3 eggs per cycle. I'm going to do 3 or 4 egg extractions so that I have my best chance. So it really has to be individualized. And there's some women in their early 40s that have 15 or 20 eggs. So it's very, very individual in terms of the probability of success for a given individual.
And I love to tell patients, I'd rather you be in the game and have something frozen than nothing frozen. And when you come time to using them, not be in the game at all. So it's always better to have them there.
That's right.
It says, what's your IUI success rates for women around 35 in general? What are your thoughts on IUI and sperm samples of 9 million with 20% motility? So a 4 million effective sample. Would you recommend still doing it or going straight to IVF?
Yeah, I think with that sperm count, the chance of getting pregnant with IUI per cycle is probably 2 to 5%. I think the success rate is very low. I think the energy and the money you would put into IUI cycles are much better invested in an IVF cycle, where success rates can be 70 or 80% with the tested embryo.
I'd have to agree 100%. I think that once you're getting normal sperm counts are over 20 million per milliliter, when you start to get maybe in the 10 to 20% zone, IUIs can be helpful. Once it starts to get below 10 million, the chances of success, like Dr. Danzer said, are in the low percentages, because all textbooks tell us that if you hit 5 million or less, you need to go straight to IVF along with intracytoplasmic sperm injection. And I think a lot of this has to do with the fact that if a woman's also 35 and not 25, I'm not sure you should be wasting much time trying to see if that sperm's going to get you pregnant. So I think your better success rate overall is definitely going to be with IVF. Next question is, if you are over 40, do you recommend IVF? Even if all your tests come back normal, including a surprising amount of eggs? Go for it, Dr. Danzer.
Yeah, well, I think it depends on several issues. I mean, how many children would someone want at 40? You say, well, we really want 2, maybe 3 kids. Well, then there has to be a commitment to IVF, because you don't want to get pregnant at 40 and then try to get pregnant again at 42, where again, the chances are maybe 2 to 5% at the most. So the number of the children for the family goes into that decision. But certainly we know that miscarriage rates at 40 tend to approach 25 to 30%, whereas with IVF, a tested embryo, miscarriage rates are only maybe 6%. So again, that's important in assessing how long it takes to get pregnant, and just the emotional stress of enduring a miscarriage. And that's an important part of the decision.
I think I agree with that 100%. I think it's really, really important to think about if you want to have another child or only just one child. If you don't get embryos frozen when you have decent fertility at the age of 40, you can say goodbye to your opportunities once you've delivered and once you come back to the office at 42, 43, because your chances are going to be about 2 to 5% and make it very complicated. I think it's a perfect opportunity that you've been blessed to have decent fertility at 40, and doing IVF will allow you to have the healthiest embryos set aside and have your highest chance of success right away as well. The next
miscarriage rates and a chance for kids in the future. You're absolutely right.
A lot of people don't think about the kids in the future question, which is something that here at SCRC, the doctors are excellent at asking and making sure to understand what your overall goals are from your fertility, not just right now getting you pregnant.
It's very important.
And then the recommended dose for the CoQ10, we said, was the ubiquinol formulation, 200 milligrams at 3 different times during the day. So it's 600 milligrams total. Please spread it out. I learned something myself. To spread it out lets absorption increase. So that's always a good thing to know. And then the next question that we have is, what is the treatment for cystic fibrosis, male factor infertility for IVF procedure? So I think that the question there is actually trying to ask if a male is a carrier of cystic fibrosis, and they may have an issue which leads to a lack of ejaculation, what is the procedure done? Dr. Danzer, did you want to touch base on the TESI procedure and how most men are positive with the cystic fibrosis?
That's right. So TESI is testicular aspiration of sperm. If there can be low amounts of sperm production within the testicle, that at the time of, it can be scheduled before IVF or at the time the woman is having her IVF procedure, because it has to be with IVF. The numbers of sperm that are obtained from the TESI procedure from the testicle are, in the low millions or sometimes the hundreds. It takes 1 sperm to fertilize an egg, but you cannot do IUI with TESI sperm. So it has to be coupled with IVF.
Great. The next question is a good one. If you have a high egg count, even at an advanced maternal age, does that mean that all of your eggs in general are of lower quality? I'd like to say that, very simply said, quality of eggs go hand in hand with female age. So there's a chance that you're going to have some eggs in there that are still of good quality, but definitely 100% the egg quality goes down as female age goes up.
We talk about 1 in 4 at age 40 may be genetically good. By 42, it could be 1 in 6 or 8. And by 43, 44, it's maybe 1 in 20. So it diminishes very quickly with age. And there are women that have 10, 15, 20 eggs retrieved when they're 43. But unfortunately, the numbers of genetically good eggs are 1 in 20. So it's very difficult to find that genetically balanced embryo.
Okay, great. And I think that was the questions that we asked about. The same person is asking about the fibroids. Should I wait until the summer? I think that it's very simple that if you and your husband are both over 40 and the fibroids were on the outside of the uterus, I think you should not wait another 6 months. And I think starting sooner because of your age is probably better. I'm going to also let Kathy answer this question. What does it cost to speak to your nutritionist if you're already a patient? And I don't know the answer to that.
So for the initial consult, which is it typically lasts 2 hours, and my analysis and recommendations and plan moving forward is $295. I do also give super bills. So you're able to submit that to your insurance as well. And then from there, we discuss plan moving forward. So it really does look different for everybody after that initial consult. It really just depends on your specific needs and what the plan looks like moving forward, how much support you need. And so it typically ends up being very different for each person after that initial consult. And like I said earlier, look for our New Year's specials soon. We'll be putting out an announcement about that too.
Great. Dr. Danzer, is there a chance to preserve one's hymen when going through the egg freezing process?
Yes and no. If it's a very small hymen, again, the ultrasound probe, we use lubricants during the process. We're trying to be very gentle at the time of retrieval. And again, the size of the vaginal probe is really small today. However, if a woman has a hymen that's has a very small opening, there is the potential to cause some tear in the hymen. But I think most women going through are able to preserve most of the hymen during the procedure. So I've had a few women that were really concerned about that, but I think they were satisfied afterwards that enough of the hymen was intact that it was not an issue for them.
So this has come up a lot in our practice because we have had a lot of women that are not sexually active desire to freeze their eggs. I've even had a woman that was not sexually active actually get pregnant with the the assisted reproductive technologies that SCRC. And I have to say, most women, whether they've been sexually active or absolutely not, once they get into their 30s, the active hymenal ring that's there just by normal activities of life have kind of worn away a little bit. So that's one thing that's really important to know. We are extra gentle and extra careful to not really damage anything during the process. And with the ultrasound probes being very small, I think the damage is going to be very, very minimal unless the hymenal ring is completely intact, where there may be a little bit of a change. So overall, everyone who's done it in the past, I think, has been very satisfactory and happy with the way that we dealt with that issue. So I don't think it's going to be a big problem for you. The next question is, for a woman who is 35 and with low ovarian reserve and no partner, would you recommend egg freezing or IVF with a donor? I don't think that anyone here at SCRC would tell someone to go have a child with a donor if you're not ready to do so. And I think if your goal is to make sure that you can try to conceive, freezing eggs would be fantastic, and I think should be done on multiple occasions to get as many as possible. But I think going forward and conceiving, if that's not your goal to be a single parent, is not something that you should be considering right now.
I've had some patients that have done one cycle to freeze eggs and done another cycle to make embryos. And obviously when you have embryos, you can genetically test and have a better idea of the potential for embryos. It's different than it is for eggs. And especially for those women that have that lower egg reserve, they're more concerned about really what is the best opportunity for me to have a pregnancy in the future. And if you have embryos that are genetically balanced, one embryo usually is about a 75% pregnancy rate. So it's individual in terms of what level of probability or assurance that woman wants to have in the future.
And the final is it possible to do the genetic testing on eggs before freezing them? It was something that was done in the past. It has actually been shown to damage eggs. When removing a polar body from the actual egg, it loses the orientation of where the nucleus are. And unfortunately, I had to learn this the hard way from a friend of mine who did egg freezing in another clinic that really promoted that over like 15 years ago. And now that she had went to thaw a lot of eggs, they were tremendously damaged by the genetic testing that was done on the eggs. With that being said, I wanted to thank everyone, and I'm glad that my partner, Dr. Danzer, made it to the call. And I wanted to thank Kathy for being a part of our first fertility and nutrition panel. I think this was a great event, and I wanted to thank everyone for their thoughtful questions. And with that, I'm going to say goodbye.
Give us a call to plan your fertility in the future. Thanks, Kathy.
Bye, everybody.
Glad to have you on board.
Thank you. It's great to be here.
Thank you, Kathy. Thank you so much. That was excellent.